One organization on the ground that's helping to ease the ongoing humanitarian crisis is CARE International. Joining me to discuss now, live from Beirut, is CARE's communications coordinator in Lebanon, Cyril Basil. Cyril, thank you so much for taking the time to join us.
Thank you for having me.
You heard some of those figures right now, absolutely heartbreaking, especially when you are reminded, when we are reminded that the most vulnerable, the children, are being impacted. What is the biggest priority right now for your organization in its humanitarian mission?
So the biggest priority for CARE is to continue supporting all the people in need. So since day one, we have been distributing water, we have been distributing hot meals, towels, shampoo, because as you mentioned, the people who were fleeing their houses in the south or even in southern Beirut were fleeing in a few seconds. So they left their houses with close to nothing. So it's very important for us to continue delivering aid on a daily basis.
And then I'm sure you heard that previous reporting as well of Israeli forces intensifying their operations in southern Lebanon. What are your concerns about how that is impacting civilians, especially as IDF forces target some of that civilian infrastructure like bridges, cutting off communities?
So for us, So for us at CARE, it is very important to continue having access to support the people in need. And so access is key. Delivering humanitarian aid is a right. And so since we have been working on delivering the aid since day one, it is very important for us to be able to continue to do so. Because as you mentioned, these civilians are women, they're children, they're elderly, they are in need of water, they're in need of hot meals. And so for us at CARE, it's very important to continue doing that and also to deliver psychological first aid because in the addition to the needs for people to eat, to drink water and to be warm because it's currently very cold in Lebanon, so we also make sure to distribute mattresses and blankets, but it's also important to deliver psychological first aid because people, especially in the south, are extremely traumatized by the airstrikes and the escalation. So it is very important for us at CARE because at CARE we do have a team of professional therapists. And so it's very important for us that the teams that are distributing basic needs, such as hot meals and water, have access, but also the teams that are delivering psychological first aid for the children, the mothers, the elderly that are deeply traumatized.
Yeah, for years I've heard from volunteers and humanitarian groups who often say that it's those wounds that you can't see, those emotional wounds that often are the ones that are the most difficult to heal. Where do some of these displaced families go to seek temporary shelter? We were seeing some pictures just now of arenas or stadiums and other facilities having to serve as temporary home.
That's true. So people are able to go to schools that have been turned into shelters and then stadiums and other spaces. We do also acknowledge that there are still people that are sleeping on the sidewalk, sleeping on the street, and seeking shelter. So any public space basically is they're using to find shelter. Some people are still sleeping in their cars also, because as you've mentioned, it's a very big number. 1.2 million people that are displaced is a very big number, and so this is why we continue working closely with the government to deliver aid where it's needed.
We've received these reports of displaced Lebanese people who say that they're determined to return to their villages, perhaps even as the bombardment continues. What would be your recommendation to some of those civilians who would consider that at this point in time?
So for us at CARE, what's very important is our commitment to delivering humanitarian aid. And as much as we can, we work very hard closely with the government to go where the need is. And so whether it's in South Lebanon, in Beirut, or in North Lebanon, we continue working closely at CARE with the government to deliver aid. Because, I mean, as I was saying earlier, the last 10 days, it's been very cold in Lebanon, very heavy rains, thunder. So people are, exhausted. If you're sleeping on a sidewalk, you need access to aid. And so it's very important for us at CARE to be able to do that on a daily basis.
Cyril Basil, thank you so much for what you and all the volunteers are doing for the civilians in southern Lebanon. Thank you for your time and for the update.
Thank you. Thank you.